This episode is part 3 in our 4-part series on how to recognize and properly address when clients object to going through the treatment process and make excuses for why they can't commit to getting their problem fixed. In this episode, I cover the following: why the excuse of needing to ask permission from someone else can be quite tricky, how to understand that they aren't looking for permission but something else, tips and tactics to help overcome this objection and help the client get the treatment they need. I hope you learned something useful from the episode that you can implement right away into your practice. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked and burnt out massage therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to reduce their treatment times by at least 50% and easily double their income. If you're new to the show and you have no idea as to who I am, my name is Dr. Matt Maggio, and I got my degree in chiropractic well over 15 years ago, but I've never performed an adjustment in practice, and I focus my treatment solely on doing quality soft tissue-based work. And I believe that the best and safest treatments in the world to fix injuries and help people get out of pain are soft tissue treatments delivered by world-class massage therapists. Thanks so much for stopping by and checking out the show. All right, so let's get into it. Just a quick reminder, this is a 4-part series. So if you haven't listened to the previous episodes, I would definitely encourage you to go back and listen to those first to really help get the most out of this episode and this entire series. I just want to start with this context here. This objection, the objection of like, I need to ask permission or I need to ask somebody else. I tend to see this objection a little later in the process, usually after the consultation and in the exam, when we're trying to get them to commit to the treatment process and the plan. I usually don't see it early on in the process, like when they first reach out and like ask questions about the treatment. It's usually comes a little bit further as we get a little more serious about like what's going on. So first idea is why the excuse of needing to ask permission of someone can be, quite tricky to handle as the provider. Well, on the surface, it does sound pretty legit and reasonable. You're like, yeah, I need to talk to my husband, my wife, my partner, my spouse, whatever. It sounds reasonable, and it really does. And a lot of times when I heard this early in my career, I'd be like, yeah, that totally makes sense. I get it. But I didn't realize what was really going on. Unlike the money excuse, it causes pause on the side of the provider and actually don't push hard enough. I always say, if you got something that can absolutely change someone's life, help them get out of pain, keep them away from the horrible medical system that's just going to destroy their lives, you got like a duty and obligation to sell your butt off and get them into that. And a lot of, providers, and I struggle with this for years as well, is we just don't want to seem too pushy. So we kind of back off a little bit. But this is what I want to try to teach you in this series, is like, it's okay to be pushy. But a lot of times when I'm training other massage therapists throughout the country and all around the world, this is one they struggle with because they kind of let their guard down a little bit. It can mess with you a little bit. At the end of the day, it's still what I talked about in the earlier episodes, a smoke screen for uncertainty that I covered before. Basically, they don't trust the product, they don't trust you, or they don't trust the business. But they're not going to come right out and say that. They're going to be like, hey, I don't trust you. I think you suck at what you do. They're going to say, hey, let me just talk to my partner or my spouse first. And then you're like, yeah, that sounds reasonable. And then you let them go. And you know what? You never hear from them again. So how to understand another concept that really changed for me is they're not looking for permission, but they're really looking for something else. So 99% of the time, that's a lot, 99% of the time, they aren't actually looking for permission because they already have that. What they're really looking for is support from their partner or their spouse or whatever. So why do they lack support? Maybe in the past they had commitment issues. Maybe they jumped from provider to provider. They never really saw anything through, didn't really give anything a chance. When this happens, I do blame other providers for not holding the client accountable and laying out a treatment plan, telling them what to do. But if you're like if you're one of those providers, I hope you're not, because you're listening to this show. I see this a lot in like the chiropractic and the PT model. People are on like visit 50 or 60 and they're not any better. Like, you're a real just piece of shit if you're stringing someone around that long. What I tend to see more on the massage therapy side of things is you just don't get enough treatment in there. You don't get enough chance. You're really trying to do those one-off visits. So those are a lot of what can happen, and understanding that they don't need permission. They really are just looking for support. So a couple tips and tactics to help overcome this objection and do what needs to be done, which is help the client get the treatment they need. So say they say something like, they're like, hey, I need to talk to my partner. Be like, I totally acknowledge it. And always say this line: I totally hear what you're saying. Is it okay if I ask you a question? It's called the reasonable man or reasonable woman tone. Like, I'm not being a jerk. I'm like, yeah, I totally hear what you're saying. It's okay if I ask you a question. Wait for permission. And then my response back is something like this. Usually when someone tells me that, what they might just be saying is that they're skeptical, that I'm even going to be able to help fix their problem. And in all honesty, I wouldn't blame you if you were skeptical either, because the current medical model is full of so many false promises and lies. So if that's the case, then what else would you need to see from me to know that you're in the right place to get this problem fixed? You're being reasonable there. You're not being a jerk. You're kind of really calling them out, because like I said earlier, it's really those smoke screens. They don't trust you, the business, the product, or that you can help them. And this kind of brings it right out. Sometimes people will be honest, but a lot of times they'll kind of just double down and hold on to their objection. And a lot of times you might have missed it earlier in the process as you go, but I want you to learn so this doesn't keep happening and you get these people the care that they need. So then I want you to just keep asking questions nicely. Don't be pushy. Don't get all huffy. Don't get all puffy. I did that in the past. I get kind of pissed off and angry, and they could pick up on that. Just keep being nice. And then my next response is, I totally hear what you're saying. Is it okay if I ask another question? And wait. And this one hits home, and it hits them really good. I say, does your, whatever they are, spouse, partner, whatever, know you're dealing with all this pain and this problem and all the pain you're going through? And then wait for the answer. And they're going to be like, yeah, they know that. They live with me. They hate seeing me like this. So I say, so if the treatment I do does exactly what it's done for others to help them get out of pain and function better, then what exactly would your partner specifically object to? It's a hard question, but it's a legitimate question, because it's teasing out that, like I said earlier, they don't need permission. They just really want support, and they want to know that you're actually going to be able to help them. Then when they answer that, I just slow down and I listen, and it's all going to come out. Their past failures, their fears, their wasted money, being lied to, overpromised and underdelivered by some really shady and just shitty doctors and providers out there that just took their money and didn't help them at all. Then I acknowledge it again. And I say, I'm very, very sorry to hear that you've been dealing with all this and been put through this. So this is where something comes in that's really important. I've talked about this in past episodes, is this idea of an excellence guarantee. So what I give in my office is I give a full excellence guarantee. Basically what that means is you are going to get the highest level of quality and service possible throughout the entire process. If at any time you don't think you got that, all you have to do is let me know, and I give you all your money back. Because like I said, I sell treatment plans, processes, and getting it all the way through until the end. And I do have that code of conduct like I talked about. Like, I'm not just like, hey, you can't just be a jackass and go through this. Like, you got to be on time. You got to commit to the process, not do dumb shit in between treatments. So I acknowledge it again. And then I have this thing, and I call it the 3 options close. And I say, so the way I see it here is you really have 3 options. And only one of them is going to come with risk. Option 1, you sign up for treatment. You go through the process. You get your problem fixed, and you feel a heck of a lot better. Option 2, you sign up for treatment. You go through the process. You don't get any better, and I give you all your money back. Now, option 3, this is the one that comes with all the risk. You do absolutely nothing. Your problem is going to continue to get worse. It's going to be harder to fix down the road, and it's going to cost a heck of a lot more. So my question for you is, what is really keeping you from picking option 1, or at least trying option 2? Then listen, see what they say. And if they still say no, politely end it and move on. And then go back and figure out where you missed something in the process. Usually you missed it somewhere early. I talked about this idea of like I continue to say this. I'm not a generalist here. I'm not just providing like relaxation and recovery. Like we're fixing specific problems. And a lot of times what happens is you miss something in that qualifying process. Like I said, you want to be a specialist in some area that you do. You want them to be dealing with that problem for at least 3 months and tried care with at least another provider. A lot of times when they haven't done that, that's when you're going to get more of the objections and things like that. So go back and review it and see what you got so you can get it right the next time. Because when you mess these up, and it sucks, and this is how I look at it, like if I don't get this right, I don't get this client the care that they need and the treatment they need, which I know I can really help them because I put the time, the effort, and I'm the best of the best at what I do. That is not cockiness. That is just confidence from knowing that I've done this for so long that they can't end up somewhere else. It's just going to ruin their lives and ruin their problem and make them way worse. And they could be hooked on pain pills. And you know what? At the end of the day, they could end up dead. I know that sounds morbid and whatever, but like I literally look at this as like a life and death thing. If I don't get this right, they're going to be going down a bad path. So that's all I got in the episode. Be sure to tune in for the next episode. It'll be the last part in the series where I'm going to go over how to properly address and handle the I don't have time right now, or this isn't the right time in my life to get this problem solved. I appreciate you checking out the episode. And as I close out every episode, every week, go out there and be great this week. The world needs access to your amazing treatments so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and ruins people's lives. I appreciate you listening, and I will catch you on the next one. Bye.